So we're going to be going over a variety of bracing techniques. When people have lower back pain, a lot of times their muscle firing is a little bit altered. So we're trying to restore some of that. We're going to go over 3 different techniques. One is a global bracing strategy, and this is probably going to be the most specific to people that are trying to get back to the gym and lift heavier loads, right? We're also going to go over an exhalation with a Kegel. This is going to target the diaphragm as well as the pelvic floor some. And we're also going to be talking about pulling the belly button towards the spine, which is going to be a little bit more relevant to the transverse abdominis. Okay? Making sense, Leanne? You excited? All right, very good. The first one we're going to go over is the global brace technique. So I'm going to have you take your fingers, relax your stomach as much as you can, and just poke them into the sides of your stomach, right? And then from here, what I want you to do is prepare like someone's going to punch you in the belly and just flex everything up nice and hard. Good. And what you should see is that initially, when you relax, your fingers poke into your belly, right? And when you flex, they should push out, okay? And you can try this in a variety of positions, so a little bit on the side, same thing, brace, and see if you poke out those fingers. And you can see if your athlete is doing this appropriately, okay? The second maneuver is going to be the full exhalation with the Kegeling. Now, Kegeling is basically stopping the flow of urine. So if you have an athlete, you're trying to teach them how to Kegel appropriately, just tell them to pretend like you're stopping the flow of urine, all right? Nice and easy. The other piece is the full exhalation. We want to make sure that people are actually getting to the end of their exhalation, and the ribs should be coming down just slightly, okay? Can you try out one of these for me, Lamb? So take a nice big breath in. Yep, and fully exhale. Good, you should watch those ribs go down. You can see that right here. And at the very end of this repetition, I want you to Kegel. So pretend like you're stopping the flow of urine. Excellent. Yep, and relaxing. Now the third technique is going to be pulling the belly button in towards the spine. So you can imagine your belly button is right here. We're trying to pull the belly button towards the spine. So go ahead and give that a shot right now, Leanne. Very good. You can actually see the belly button going in towards the spine, so that works out really well. So the next thing we're going to be doing is practicing these bracing strategies while performing a core exercise. We're going to be doing a dead bug. So let's have you go towards the wall and put your hands into the wall. Very good here. So the first one is that global bracing strategy, okay? So I want you to brace like someone's going to punch in the belly, Leanne. And let's bring up both legs. Let's perform a dead bug exercise nice and slowly. Good. Excellent. Back and forth. Good. Let's have you relax. So the next exercise is going to be the reaching with a full exhalation and the Kegel, okay? So basically you're timing the exercise with your movement, all right? So let's bring up your knees here. Good. As you exhale, I want you to slowly reach one leg out. And when you get to the very bottom of your exhalation, your leg should be fully extended out. And I want you to Kegel and then come right back in. Breath in, and the next blow out, the other leg goes. You ready? Good, blowing out, blowing out, blowing out. Full exhalation, Kegel, yep. And then bringing this leg back in with your inhalation. Next exhalation, next leg goes out. Fully reach, blow out, blow out, blow out. Kegel, and come on back in again. Good, take a breather, relax. The last one, what we're doing is pulling the belly button in towards the spine and performing a dead bug while we're doing that. You ready? Okay, go for it. Good, belly button in. Yep, I can see you're doing a good job. Good, back and forth. And during these bracing strategies, so abdominal bracing as well as the belly button towards the spine, you should be able to breathe while you're doing it. Okay, so we're trying not to Valsalva while we're doing this. Make sense, Leanne? Core is looking great. Thank you.